Go ahead and come in. Yes, right through that door. Please watch the small ridge in the doorway. Patients tend to trip on that when they're tired. Good. You're here now. You can set your personal belongings on the chair to your left. The sleep clinic is quiet this time of night. We intentionally schedule these assessments after standard hours to reduce external auditory disturbances and circadian interference. I'm the doctor. You're welcome to call me Doctor, or simply use my name if it feels more comfortable. I'll be conducting your overnight evaluation, including the diagnostic intake, behavioral sleep assessment, and non-invasive monitoring. Everything we do is designed to help me understand the physiological and neurological patterns interfering with your sleep integrity. Before we begin, I want to confirm patient identity. Could you please state your full name for me? Thank you. And your date of birth? Very good. You are matched to the file I have here. Now, I'm going to describe the room so you can orient yourself. The lighting is intentionally low. The lamp beside the examination recliner is calibrated to emit warm spectrum light at approximately 1800 Kelvin. This minimizes melanospin activation in the retinal ganglion cells and supports pre-sleep relaxation. To your right, you'll see the monitoring console. The screen is dimmed, but it will record data once you're resting. Respiratory rate, pulse oximetry, and micro movements detected by the bed sensors. None of these require your active participation. The recliner behind you is padded and adjustable. The headrest can be raised or lowered depending on your comfort. We'll be conducting the initial assessment there before transitioning you fully to the reclining sleep posture. If at any point you feel discomfort, overheating, or sensory overstimulation, just let me know. Everything in this environment is adjustable. My goal is to reduce sympathetic nervous system arousal as much as possible before sleep onset. Please, take a seat. Very good. I'd like to gather a few baseline details about your current sleep concerns. I know you filled out the questionnaires earlier, but hearing your responses verbally helps me assess voice tension, breathing pattern, and cognitive load. First question: how long have you been experiencing difficulty initiating sleep? Thank you. And how often do you wake during the night? Understood. Do you experience physiological symptoms during these episodes? Rapid heartbeat, muscle tension, or temperature fluctuations? Good. As you're speaking, I'm observing a few things worth noting. Your inhalations are shallow and somewhat irregular, indicating mild pre-sleep autonomic dysregulation. Your shoulders appear slightly elevated, likely residual upper trapezius tension. Your blink rate is slower than average, which is consistent with fatigue accumulation. Please, don't worry about any of these observations. They simply help me tailor the protocol. You're doing exactly as you should. Now, could you rate your current level of sleepiness on a scale from 1 to 10? All right, thank you. I'm going to ask one more question, and you may answer aloud or simply nod. Have you attempted any relaxation techniques on your own tonight prior to arrival? Good. That helps me adjust the intervention sequence. Let me make a notation on your chart. There. Now that we've completed the intake portion, I'd like you to lean back slightly and rest your hands on your lap. We'll proceed to the first stage of the induction protocol. I'm going to adjust the recliner to a slightly more supportive angle. You may hear a quiet, mechanical whirring sound as the backrest lowers. There it is. Good. Let your head rest naturally against the cushion. If you feel any strain in the neck, let me know. Excellent. Your posture looks stable. Now, I'd like you to shift your attention to the contact points between your body and the recliner. The surface beneath your shoulders, the support under your lower spine, and the mild elevation under your knees. These are all designed to distribute your weight evenly. The more evenly supported you feel, the easier it will be for your nervous system to downshift. Please allow your arms to settle. If your hands feel tense or curled, just let them open naturally. Very good. I can already see a slight improvement in your respiratory pattern. Not fully regulated yet, but the mechanical consistency of your breathing has increased. That's exactly what we want. You may close your eyes at any time. You don't have to, but many patients experience reduced sensory overload when they do. You're welcome to keep them open until you're ready. I'm going to move slightly closer so I can evaluate your facial tension. You may feel my presence on your left and then on your right as I switch sides. Just breathe normally. No need to change anything. Your brow shows minimal corrugator supercilii activity, meaning you're not frowning or resisting the process. That's good. There is, however, slight tension in the masseter muscle on the left side of your jaw. That's very common in patients with nighttime restlessness. We'll address that in the relaxation phase. Your ocular micro-movements look slow and controlled. That's another indicator of accumulated fatigue. Your respiratory rate is averaging between 12 and 14 breaths per minute, slightly elevated for pre-sleep conditions, but with normal range for situational anxiety or mild hyperarousal. Don't worry, we'll bring that down gradually. I'm going to make a brief notation. All patient responses within expected parameters. Recommended guided relaxation with emphasis on down regulation of somatic tension. All right, we'll now begin with structured relaxation sequence. We're going to use a progressive muscular relaxation technique adapted for clinical settings. I will guide you through each section of the body slowly. You don't need to move dramatically. Micro adjustments are sufficient. Allow the skin across your forehead to smooth. Any small creases or tension, let those release. Good. Now your eyes. Let the muscles around your eyes soften. You don't need to close them tightly. Just let them rest in their natural position. Very good. Your jaw. Let the teeth separate slightly. Don't force it. Just allow the jaw to release. The masseter muscle should begin to relax on its own. Excellent. Your neck. Release any tension at the base of the skull. Allow your head to settle fully into the headrest. Good. Shoulders. Let them drop by a few millimeters. Even the smallest downward shift signals to the autonomic nervous system that the environment is safe. Perfect. Arms and hands. Feel the recliner supporting your arms. Let your fingers uncurl. Good. Chest. No need to change your breathing. Just allow your chest to feel broad and unrestricted. Stomach. Let the abdominal muscles soften. This will allow your diaphragm to move more freely. Hips and legs. Let your legs rest without engaging any muscles. The recliner will support you completely. Feet. Let them fall naturally outward. No tension. You're doing exceptionally well. Your muscle tone has visibly decreased. This is exactly the response we aim for in the early stages of sleep induction. We're now going to begin a guided breathing sequence used in clinical sleep interventions. I'll be counting for you in a slow, controlled pattern. Phase 1 is baseline regulation. Inhale through your nose. 1, 2, 3. And exhale through your mouth. 1, 2, 3. Once more. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Very good. Phase 2. Diaphragmatic expansion. Inhale slowly, allowing your abdomen to rise. Hold for 1 moment and release slowly. Good. Again, inhale, gentle expansion, hold, and exhale fully. Your breathing is already showing increased rhythmic stability. That tells me your vagal response is improving, and that's exactly what facilitates natural sleep initiation. Phase 3, extended exhale. This phase has strong evidence for promoting parasympathetic activation. Inhale normally and exhale slightly longer than before. Let's repeat that. Inhale and exhale, drawing the air out gently. Excellent. Your heart rate should be decreasing slightly now. You may feel a sense of heaviness in your limbs. That's a positive sign of autonomic downshifting. While your nervous system continues to settle, I'd like to ask a few diagnostic questions. There is no right or wrong answer. Your breathing can continue at whatever pace feels natural. Do you often find your mind becoming more active at night than during the day? Thank you. Do you experience recurring thought patterns when attempting to sleep? Understood. Are these thoughts emotionally charged, or are they simply persistent? Noted. Do you experience physical restlessness, such as the need to adjust your position frequently? I see. That's helpful. You're doing extremely well. Your physiological responses remain within therapeutic range. I'm going to move slightly behind you now so I can speak close to your left ear, and then your right. This is to facilitate auditory focus and reduce external distractions. Your muscle tone has decreased nearly 20% since intake. You're progressing exactly as we expected. Your breathing has become much more regulated. That's an excellent sign. You don't need to change anything you're doing. Your body is already responding to the environment. If you feel a sense of warmth or heaviness, that is a normal component of sleep onset. Very good. Based on your breathing pattern, muscle tone, and general responsiveness, I'm going to transition you into the final induction phase. This part involves passive listening. There's nothing you need to perform or adjust. I will speak more slowly now. This pace is clinically optimized for pre-sleep disassociation from conscious effort. Focus on the sound of my voice, not the meaning, not the words, just the tone. Allow the auditory rhythm to guide your breathing. Your eyelids may feel heavy. Your limbs may feel distant. These are standard signs of reduced cortical arousal. Your thoughts may feel slower. They may drift. You don't need to manage them. They will settle on their own. You are in complete control of your comfort level, but you no longer need to control your environment. I have had that part handled. Your only task is to rest. Your body is fully supported. Your respiration is stable. Your heart rate has slowed to an optimal pre-sleep pattern. At this stage, you may feel as though sleep is approaching from the edges of your awareness. This is normal. This is expected. This is safe. Let your eyes close fully now. Good. Breathe continuous and smooth. Inhale and exhale. Your muscles have released their residual tension. Your mind no longer needs to monitor your surroundings. You are monitored. You are safe. You can allow your consciousness to drift lightly, gently, effortlessly. You may sleep now. There is nothing else you need to do. Your body knows what comes next. Just follow it down and down into rest. Good night, patient. I'll remain here and monitor your vitals while you sleep. Hey there. YouTube only lets me misbehave so much. So if you want the uncut, extra spicy stuff, plus bloopers and exclusive audios, you'll have to catch me on Patreon. Don't be shy. The link's right there in the description. I'll see you there, baby.